Hi, everybody. I'm getting a poor network message, so I'm just going to leave my camera off.
Okay, I'll do the same thing. It might be.
So Josh, and you know, you got the message that Dave had a family emergency and Josh isn't able to attend. So Juan, it's just you, and just as a reminder, we're all recording this just so that they can get that background and info while they're out. But I'm gonna mute and you guys go for it.
Okay,
Thanks.
we'll start with Cindy and then Sarah, and then I'll follow, and questions at any point, Juan. So thank you, and thanks for making arrangements to record this.
Great, thank you.
So I don't have a whole lot to update from my end other than we got 4 new cases today. The cases seem to be coming in pretty stable. We're actually seeing a little bit of a decrease in case numbers as they're coming in. We were seeing them more in the teens. Now it's more like 4 to 8 a day. So that's pretty good. Our R value also continues to drop. So we're below 1 right now, which is really good. That's what we want to see. So that's about all I have, but Sarah has a lot to talk about with what we've got going on in operations. So I'm going to turn it over to her.
Hi, thank you, Cindy. So I'll start with our infectious disease branch. Let me just I'm going to share my screen for a minute to just kind of give you a quick organizational chart overview to give you I'm a visual person, so sometimes that helps. So this is our general incident command structure. You can see Cindy at the top as incident commander and Ellen as our health officer, and how it's broken out into operations, finance, logistics, and plans. And then when I go to the operations breakout, things get pretty big. And so under operations, and this organizational chart was from the beginning of August, and so people have changed and we filled in a lot of roles, but we do have our testing branch, our infectious disease branch, and our environmental health branch. So just to give you some perspective of all the work that is occurring in here, there's a lot happening. So I'll unshare my screen here and go back to the update. So for the case numbers for cumulative cases in Missoula, we are at 421. That includes 4 epi-linked cases. Actively, we have 46 cases. Recovered, we have cumulatively of 372, and we have 3 deaths. Active close contacts that are being monitored are 273 plus, and have a couple of hospitalizations. So going into some more detail in the infectious disease branch, we do have 52 staff that are working within this branch. The coordination task force, which is our call center, continues to operate Monday through Friday, 8 to 5. We have our RN coordinators that work with the stakeholder groups, the long-term care, schools, the first responders, hospitals, clinics, and homeless population coordinators. We do those regular heat calls and provide guidance and information throughout the week as needed. Our non-congregate shelter, the Sleepy Inn, we do have a dedicated social worker working with our tier 3 residents or guests. We do have 9 rooms available to that, and then tier 1 and 2 are for folks that are experiencing homelessness or otherwise do not have a safe place to quarantine or isolate. If they were.
Sarah, I'm sorry to interrupt you. We just had another person join the meeting and I can't see who it is. I just wondered who joined us.
It's Cameron Evans with the Missoulian.
Okay, hi Cameron, thank you.
Yep.
Thanks, Anne. So let's see. We do have 16 rooms for our tier 1 and 2 quarantine and isolation as needed. In our COOP group, which is continuity of operations for infectious disease, we do have ongoing infectious diseases that are continuing despite COVID. So they're working through some syphilis, HIV, Campylobacter, Salmonella, bites, rabies, things like that. So they're still holding down the fort in the background. In our COVID group, we have filled those lead positions for the case investigator, contact tracing, monitoring, and administrative support. important. So we've definitely continued working on building the depth and capacity since we've last done an update for you. We're working on the processes for coordination between those groups and continuing to work on protocols and planning. In the testing branch, we have 29 staff dedicated to this branch. We have tested over 3,000 people since we began our inception back in the beginning of April. We're averaging around 158 tests per week. And we've been, like I said, going since the beginning of April. Continue to offer testing Monday through Friday with our rural mobile clinics on Tuesdays and Thursdays. Tuesdays we go to Sealy and Clinton, and on Thursdays we go to Lolo and Frenchtown. We are now completely located at the Flynn warehouse location. So patient services where we do the scheduling and all of that, everybody is all under the same roof, which is super exciting and great. Working with logistics to get everything set up there, and things seem to be working out the kinks and running fairly smoothly. Certainly is creating opportunities to improve efficiencies in those processes to the point of where we're going to be able to schedule more people throughout the day. In regards to our rapid testing, we're hoping to get that running by the end of late next week. Our hood is installed. We're waiting for some filters and a final inspection, and we'll definitely be making an official announcement when we're ready to do that. We're currently working on what the processes will be for our validation period, which is at least 30 days, where we need to do 2 swabs on individuals, one for the rapid test and one for the PCR. So working on our language for how we're going to explain that to people from the get-go, so that nobody's surprised and that they understand why we're doing that. So lots of great things happening there. And then in our environmental health branch, which is our very own environmental health branch at the health department, they do have 16 staff. We did add 2 staff to help. One is specific to masks as a environmental health compliance specialist, and the other one is to help with regular environmental health COOP duties, continuity of operations. There's one vacancy that's coming up that we're hoping to fill as our infamous Alicia Johnson is leaving us at the end of this week. So big shoes to fill there.
That's a bummer.
Yes. So we are all lamenting, and yes, we're going to miss her. So on top of COVID, we're trying to maintain our regular environmental health duties for inspections and licensed establishments and everything else that environmental health normally does. So they continue to respond to all complaints and compliance issues. Since the board mask rule was adopted in July 9th, we've received 664 COVID-related complaints. We continue to provide education and guidance as a primary intervention when following up. And then we work through steps with our health officer, incident commander, and legal when needed for progressive enforcement or closure if needed. Continue to work on providing interpretation and guidance and updating guidance documents, and collaborate with the infectious disease branch for where there's overlap with things like schools and such. So amazing work that's occurring in the operations section, and I will turn it back over to Cindy or Ellen.
Okay, I want to keep plugging the our epidemiological situation unit presentation of last week, which is headed up by the University of Montana, specifically the professor of epidemiology, Erin Simmons, and her team, and also members of our team that work on data and situation. It is really the reports back we've gotten from decision makers in various positions, particularly schools, is that was a very helpful review for them. So please continue forwarding that. And in Cindy's daily update, she'll continue to focus on various of the indicators that they explained. I think our biggest issue in terms of public information right now is the school sports, and there is definitely a rumor and an impression that we're working to correct that in Missoula County certain school sports won't be allowed, and that is not at all the case. School activities are part of school, and they are governed by the governor and primarily by the local school boards, and the activities, of course, themselves by the Montana High School Association. So when those activities occur, some of them generally bring a lot of spectators. And when a school activity intends to have spectators, which we intend to allow, that turns it into a public event under the existing health board health officer rules. And that's the case in all of the large counties. So I've been working with the large counties. Each of us has a slightly different situation based on epidemiology and the way that their community has approached spectator events or large group events. And as you're probably quite aware, in Missoula, we have a pretty well practiced at this point method for those types of events. The wrinkle comes when we get something that has a large number, over 50 of folks who would be interacting, particularly and can't be at social distance. And that occurs when you have football. That's just the nature of it. And so what we're working to do is how to incorporate what the school allows and we support, and that is those school activities, including athletics, with spectators. And in almost all types of sports, it fits fine. You know, with certain mitigations, certain limitations, all the types of things that you're used to, particularly here in Missoula, since we've used that method and that guidance for all of, even parts of our fair, as the commissioners are quite aware. The fair broke things down so that certain activities could go forward under that guidance, and that is very appreciated. Again, I want to say that. It's just difficult to match the two together when it comes to football. So that is the last part that we're working on and trying to be as consistent as possible with the other large populated counties. And so I have the final draft of that guidance, just got reviewed by our county attorney. And as soon as I can coordinate that with the school superintendents so that they get the last look at it before it is finalized and approved, that will come out. But in the meantime, it'd be very helpful for the public, and the Missoulian did report it yesterday. School sports are going forward, and spectators will be allowed, and it will be different with some sports based on those conditions I mentioned. That's the main thing related to the actual COVID activity. We do have an issue and an idea, and I'd like to ask Shannon to present that idea related to some of the questions and understanding about local public health authority. So something's buzzing, but I'll just let that buzz. I don't know what it is, and I'll ask Shannon to introduce that topic.
Okay. Hello, everybody. Shannon Terrio, Director of Environmental Health. So we were talking, as I think some of you know, not you, Juanita, with Rebecca yesterday, the Missoula County lobbyist, and talking about the upcoming session, which it's hard to believe that the upcoming session is kind of growing so near really already. And talking about what we might be looking at in terms of public health and public health protection during the next session. So what we were brainstorming and thinking about is that, Juanita, we know that there is a meeting coming up with legislators, Missoula area legislators next week, and we'd love to have the opportunity to talk with them about the importance of public health, the history of public health authority, why that history, why that public health authority is important, and why a lot of people don't always understand the public health authority, just to have it in their brains so that they can, when they hear from constituents and hear from their peers, they can talk about why it's important, and also help us think about how we should kind of address public education and legislator education during the session. And I think Ellen is prepared to talk about some of that even today, because she's lives prepared to talk about public health authority and the reason that it exists, or we can leave that for next week if that feels like something that the commissioners feel is appropriate.
Oh, absolutely appropriate, and looking forward to hearing next week or now. I don't know what people's schedules are.
Is next, September 8th isn't next week, is it?
Well, I meant, I meant that.
Okay. Well,
Sorry.
yeah, I mean, I'm sorry, but, I spent all yesterday thinking it was Tuesday, but today I think it's Friday, and I'm sorry, I just remembered I'm being recorded and the media's on. But that said, generally, the history, of course, don't have to give the whole story, but generally public health arose in the U.S. out of the need to stop communicable disease and the conditions that promote communicable disease. And that those conditions are so very often environmental, and so that's where you can see the environmental piece. And then, of course, as we fooled ourselves into thinking that we really had halted communicable disease in a big way, I think some of that history and need gets forgotten. But in fact, the quarantine and isolation authorities that we use them all the time, and they're usually very cooperative. We work with the doctor and the person or the family that needs to stay home. Perhaps they didn't have a certain immunization, and they have the disease or have been exposed. So we do that a lot, and most of it is non-regulatory. Just like much of what we're doing now is non-regulatory. It's really trying to figure out what is the best way to respond and what can everybody do to try to make that work. But it's usually, when you look back on it, many of the authorities were to try to keep the spread of disease from, let's say, one county moving into another county. So we're very conscious of when we have pertussis, we're not just worried about our county. We don't want to be the county that let it get out of control, and pretty soon we're the epicenter for the state or the region. So it's usually, let's keep that disease in our county and smother it. And there's so many ways that once you stop transmission now, first of all, you can prevent it with vaccines, and you can stop it with cures, and you can sometimes stop it with vaccines. And at the very, lacking everything else, you can stop it with a person or a family quarantining for a certain period of time. So that goes on all the time. I mean, that is just all the time. And then it appears every 100 years or so, in this case 102 years, you get a whopper of a pandemic. And the idea isn't to keep it into your county, it's to keep it out of your county, keep it out of your state. And that ends up involving everybody, because we don't have the vaccines and we don't have the cures. And in this case, we have a very stealthy virus. I mean, by the time you find it, particularly with some of the testing challenges, the spread can be very wide. That all said, Missoula, as usual, has come together and done a lot of the things that normally we just don't have to do. We don't have to do. And one piece of that is to set the guidelines on what those limits are, so that if we're all sacrificing and taking precautions and we're buying time and we're buying a buffer from that disease really just taking over, that no one activity gets to use up that time that was bought or that buffer that we all worked for. And that's really where the regulations come in, first as guidance for self-protection, but also to just keep buying that time, pushing back. And a lot of good things have come about simply because that are available to us, mostly in the form of information and testing, and perhaps even a vaccine that will eventually be employed. But that said, it's the dynamic of what people experience is almost upside down compared to how we usually would use that regulatory power. And they've not experienced it, not seen it before, and it's a very hard time for everybody. There's nothing that can go forward exactly in the way that it usually goes forward. And that is hard, very hard, from funerals to weddings to school to work. I mean, you know that. However, I think because none of us have been through a pandemic like this. No one living in this country has been through a pandemic like this. We aren't through it. But it's raised a lot of questions about what's really very long-standing authorities that worked so well that we really didn't need them on a large scale for a long time. And we want to explain those because, the health board is appointed by elected officials, does include elected officials, and also has duties and limitations set forth by statute. And then it gets further confused when the governor, this is not a criticism, but then the governor steps in and introduces things that have to be statewide. One county saying, oh, we're going to beat the pandemic that's ridiculous. So the governor steps in, and I just think that there's just a lot of confusion. So I'd like to present that. I would be glad to hear your feedback on just the synopsis so far, and then just kind of lay out how these appointments are made, not only in Missoula County, but across the state, and then answer their questions. And so I think it would take a little bit more time than it does when you just say, well, there might be a bill that does this. I would see a good 15 minutes if that's possible.
No, I think that's really important. I don't know, Cameron, do you have any questions so far, or need some clarification or anything? What Ellen's just shared?
Sorry, I don't think so. I think it's all pretty clear so far.
Okay, thanks.
So that's really all I had to say, and if that can be a part of the scheduling, I would work really hard to actually also include that specific line of authority and purpose and limitations, which I didn't do here because I think you're all more familiar with it, but I would do, of course, for the our legislators.
Great, and I see Chris is still on, so that's great. We can do that, right, Chris?
Yes, yeah. Sorry, trying to find the mute button. The unmute button. But yes, yeah, we'll be ready when the time comes. Legislature.
Thank you.
Thanks. And I think that other than any questions or your public comment period or whatever, we have covered what we intended to cover on this update.
I don't have any questions. I'm just really glad you're going to take this opportunity to share some history, what you're up against, and what we need to do going forward.
Yeah, thanks. Really, and I want to mention, because Sarah, I know I was just on a meeting with you on, and Sarah and Cindy and Shannon, the commissioners signed our Abbott testing agreement today. Yay!
Yay! Thank you.
Get those last parts in there, and let's go. Thank you for your time, and thanks for recording this.
Wait, there's one more thing. I think that we were also going to update the commissioners on what happened at the board meeting in terms of the flavored tobacco ordinance.
Oh, thank you.
How about that? Yeah, thank you.
Yep.
So Shannon, do you want to do that, or Cindy?
I was.
I am less familiar with the actual resolution, but basically the gist of it was that the board is supportive of the ordinance that is being presented to the city council.
Yeah, I guess I could add to that. So specifically, you know, basically what we did with the health board last time is the same thing that we did with the commissioners at our last health department BCC update, which is to talk about the proposed ordinance and to look at the scope of it, and then to give the health board the opportunity, which they took, to adopt a message of support for when it does go to the city council for deliberation as a city ordinance. And so the health board looked at the scope and did end up approving. They had written a resolution earlier encouraging both the city and the county to do more to restrict youth access to flavored vape products, and to help address the epidemic of more youth becoming addicted to nicotine through flavored tobacco products. And really, as we were looking at the issue and working with partners, including those at the state, found that flavored vape is absolutely a vital thing that we need to address, but so are other flavored tobacco products, some of which are displayed at child eye level and are marketed with packaging that looks like candy, and are things like mints that contain nicotine and are various ways for people to become addicted to nicotine. And then there's studies that show that once people are addicted to nicotine, they're more likely to also smoke regular cigarettes, which have all the other problems associated with it, not just with the nicotine, but with what you are inhaling. And so the proposed ordinance at this point, which I don't think has yet been introduced to the city council, is looking at restricting both how products are displayed and flavored tobacco products in general from being sold. And so the board looked at that and said, yep, this would accomplish the goal of reducing access to youth and to other non-smokers who are more likely, have been shown more likely to start smoking if you have the tampering effect of flavors, including things like menthol. So the next plan is for it to go to, is for Mirta Becerra to introduce it to the city council, for it to go to committee, and then the city council to debate it. If the city council does end up adopting it, then it would come back to the health board and to BCC for you to consider adopting it or approving it. And if you approve it, then it could go into effect 5.5 miles outside the city limits as an extraterritorial health ordinance. So that's where I think we are in the process.
And when, I'm sorry, timeline again?
She was hoping to have it introduced, I think within the next month, but you know, they're to at least the city council committee.
Okay.
But I'm not sure. I haven't seen any email traffic to let me know that that's been the case yet.
Okay, thanks.
Yep.
I don't have any other questions.
Okay, well, I do think that is the end of the agenda now.
Oh, but Shannon, I do have a question on a totally unrelated subject. Are you around? I have a septic question. Can I give you a call after this meeting, or are you in another meeting? Okay.
Yep, no, I could be available.
Awesome, thanks.
I might not have the answer, but I know people who will, so. We'll talk about it.
Great, thank you.
All right, well, thank you.
Yeah, looks like we're done. Thank you, everyone.
Yeah. Thanks everyone for keeping this this update on track for us. I appreciate it.
Thanks.
Yeah, me too.
Bye.
Bye.